Thank you so much. These were absolutely incredible presentations with wonderful nuggets for us to begin to discuss with the panelists. And so I'll now share with you some of the questions that have emerged during your presentation. And I'll start with an audience question to Dr. Heller. And they said, for Dr. Heller, there seems to be various evaluation methods for the different power components of your framework, which seems daunting. Are there any examples of overall evaluation methods in the application of this framework? So can you make this real for us is what someone is asking.
What I heard in that was, is there one evaluation framework that can capture all of this? And I don't know that there is. I think that power is multifaceted, and that different aspects of power are going to you're going to need to evaluate them differently. And I guess my suggestion is to have a theory of change based on these power frameworks, and let that be the guide of what evaluation methods are needed. I'm curious to hear if others on the panel have better answers than that as well, though.
Any additions from the other two panelists?
Well, I hesitate to say this is a better answer, but it's an additional answer, which is that we developed a framework in a report that's available on our website, which is, if you just Google ERI USC, you'll find us. And it's called Transactions, Transformations, Translations, which was about the distinction I was making between transformational change and transactional change, and how that gets translated to both the organizations being assessed and also to the outside world to communicate the importance of transformations. And we actually have a wide range of examples that are in that report and various specific metrics, which folks have been building on Jonathan's excellent work over the years. And we did a series of evaluations with it, and others have too. So it's a starting point. But I think that what Jonathan is mentioning, and I'm sure Danielle would agree with, is important, which is that when a field is now emerging, there's probably no set framework yet. People are experimenting, trying to see what works, and getting constant feedback to the evaluators as well as to the people being evaluated is absolutely critical.
Anything to add, Danielle? Yes. Great.
The only thing I would say is something that's become a bit of a refrain for us internally, which is that the question drives the method. And so, the method is really dependent on the question that you're asking and what you're trying to learn. And so I would never, recommend some specific method to be applied in all cases.
Another question that emerged, it's really the panelists for each other. And the comment was, Jonathan talked about influencing decisions making and tools that exist for health communities that focuses on health equity or equity. As part of the modernizing regulatory review executive order, it's a lot of words together, has the administration been incorporating these tools and the focus on equity? This is for Danielle. And what do you think about Jonathan's suggestions that such tools should be used to build community power? Can the federal government support that kind of work?
I think that's a terrific question and something that I'll be continuing to think about. I will say I don't have a lot of firsthand knowledge about the implementation of that specific EO, Modernizing Regulatory Review. I'm aware of it, but that's not something I've been involved with. But with the racial equity EO, and they have a lot in common in the sense that they both require a systematic review of agency policy. They're explicit in the goal of addressing inequity, and they require engagement with stakeholders. And so there are definite challenges in finding the optimal ways to identify and engage with community stakeholders. And I think that agencies are a bit struggling with that, and continually seeking better ways and approaches to do this kind of engagement in a sustained and authentic way. I think that's a challenge right now for governments. We've got, the Paperwork Reduction Act. There are various limitations that constrain engagement activities. And so I think everyone's really trying to figure out how to do this well and how to engage with people who don't typically engage or know to look at the Federal Register to send in comments or are in those normal channels. But there's a real interest there to do that. And I would think that the suggestion that these engagements can and should support building and strengthening community power is in line with the spirit of these executive orders. And there are many proposals that I've seen to build community capacity. And I think that may be a very government-ease way of talking about it, but I don't think it's that fundamentally different. There's definitely an interest in building community power, strengthening community voice, and improving opportunities for partnership.
That's great. Any reaction from the other panelists? Because each of you talked a bit about community engagement in the process. And I think we have like 4 minutes before we have to stop. So any comments from Jonathan or Manuel? And particularly around how communities are being prepared and partnered with in order to do this work.
Yeah, I mean, I appreciate your response, Danielle. It's great. I think that too many times I've seen in the work that we've done, governments trying to engage community really because they know they're supposed to and not for any particular goals. And often it's not very satisfactory to the community, right? And so thinking about like Arnstein's ladder of engagement, trying to move up the rungs of that to actually shared decision making should be a goal that our local governments, certainly it's hard to do at the federal level, but our local governments certainly should be doing. And I think that would fully engage and value community the way it needs to be if we want to advance that health equity.
The last word by Manuel.
Thanks. Well, the thing I would say is that I find that it's incredibly important to bring community actors in to the design of the project in the first place. So when virtually every one of the projects, that I've described, we actually started by convening community organizers, power builders, saying, what are you interested in? This is what we're planning on working on. How would you sketch this out? Midway, we always stop and say, does this make sense? Do these findings resonate? Will they be useful? And I believe I've seen Jonathan do this as well, that when we present, quote unquote, the findings at the end, we often present for 10 or 15 minutes and have 45 minutes of community actors commenting on what it means for them. It develops a sense of ownership of the project, but when people say that there's brilliance in the community, you could think that they're feigning some gesture. But if you work with communities, there's brilliance in these communities. They actually know what their problems are. And they may not know how to do a GIS map of the hazards in their neighborhood, but they know there's hazards in their neighborhood and that they are creating problems for their health. So listening to that brilliance, using it to inform the research, and making people part of the dissemination and meaning making that we were all talking about, I think that's key.
What a powerful way to end this session. I just love it. You guys have done a fabulous job.